Welcome back to part 2 of phase 1 metabolism, as well as looking at phase 2 metabolism in more detail. My name is Matthew Jose. I'm a second year student at Liverpool University. So once again, before I carry on with my lecture, I'd just like to give all credits to Dr. Dan Carr, who's my pharmacology lecturer, who's made this PowerPoint presentation. So by no means are these lectures created by me, it's created by him, but I'm just using these lecture slides because I feel like they're very very good and very well illustrated and easy to understand. So let's get moving. So last time I talked about the P450 oxidation. So we included aliphatic hydroxylation, we had aromatic, and then we had epoxidations. We also had dealkylations, and this contained 3 different forms. You have the O dealkylation, N dealkylation, as well as S dealkylation. One thing to be aware was that all of them form the byproduct aldehyde, as you can see here. Now, if you're new to this video and you want to know what happened in the previous video, please find phase 1 metabolism. This is phase 1 metabolism and phase 2 metabolism, this video. So in the next 5th one was deamination. So you look for a primary amine, and usually what you end up with is a ketone and ammonia. An example of this was amphetamine. So you simply look for the NH2 and the side group associated with it, and you simply end up forming ammonia, and you end up having a double bond O, which is a ketone. And oxidation was a bit more complicated, and it involved secondary amines. Clozapine, which is an antipsychotic drug used to treat schizophrenia by doctors. Another one is X-oxidation. Alcohol oxidation is very familiar to all of us, as those alcohol consumers would know that they usually develop an hangover, and a hangover is due to the aldehyde, which usually causes the hangovers. And doctors usually prescribe people who are alcoholic something called antabuse. And so what that does is the aldehyde is usually cleared and broken down in the liver and then oxidized further to a non-toxic product, right? Antabuse basically inhibits the enzyme which breaks down acetaldehyde in the liver, so therefore you get this really nasty headache and a hangover, so you don't feel like drinking anymore. So that's the whole purpose of antabuse. Dehydrogenation is paracetamol can be changed into NAPQI, which is an anti-malarial drug. So you just simply remove all the hydrogen and you end up with a byproduct of water. Dehalogenation is removal of halogens, and it's very quite rare that occurs. Right, so P450 enzymes are usually divided into 18 different families, as you can see here. And a number of key P450 isoforms are responsible for the majority of hepatic drug metabolism. Right, so you've got cytochrome P450 1A1, 1A2, 2B6, 2D6, and various different ones. So 2D6 is involved with morphine oxidation, whereas 2C18/19 is involved with clopidogrel, which is also referred to as Palvix or Palvelix in terms of the branding name. And this is usually given to patients who have just undergone an angioplast or having a stent put inside one of their arteries due to atherosclerosis. And what clopidogrel does is it prevents the stent from occluding, so therefore the artery doesn't become, the diameter doesn't decrease, so there's a less likely possible cause of thrombosis a second time around. So this is just a few of the different subtypes. So 1A1, 1A2, 2D6, 2D6 morphine. But different isoforms also have different substrate specificity. So these are the substrates. So it's 2D6 is morphine, 2C1819 is clopidogrel. Alright, some drugs can be metabolized by multiple isoforms. So morphine, for example, I'm just taking this as an example, is that it doesn't have to be just by CYP2D6. It could be by some CYP2D7 or something like that. That was just an example. Okay, so just bear that in mind. So codeine toxicity is something, okay, drug to drug interaction, two drugs are competing, right? These things, why doctors usually advise patients not to take two drugs at the same time unless they're safe to do so, is because two drugs could be competing for the same active site on the P450 enzyme, right? Which means one will be more effective than the other because they can bind more avidly to the active site. Drug-diet interactions, so for example warfarin and grapefruit juice can have serious side effects. Milk and tetracycline causes chelation of the tetracycline. Some patients have genetic variation, so they have a P450 enzymatic, can lose or gain P450 enzymatic function. This is also referred to as pharmacogenetics, and we'll touch on that in a much more later stage. So underlying disease, other things that could affect the P450's underlying disease, environmental factors like smoking, alcohol, the lifestyle, and various other ones. Codeine is primarily metabolized by the P450 enzyme. Some people can carry multiple copies, so that they basically means that they are ultra rapid metabolizers. So this is also an example of pharmacogenetics in action. So some people, instead of having one normal copy of CYP2D6, they may have various or more than one copy of the cytochrome 2D6, which means that they're ultra rapid metabolizers. So now what effects this has is usually they need a very high concentration because most of the morphine becomes metabolized and excreted without even reaching the effective concentration. Or sometimes when you give the right, if they have the right dosage, what happens is that they usually metabolize it very quickly, and it goes into the plasma concentration and it shoots up, and it can cause what's known as toxicity, which is slightly not the best feeling to be encountered with. So example is children receiving codeine for tonsillectomy. So this is the removal of tonsillitis. Newborn babies receiving breast milk. So, you know, before in the last lecture, we mentioned that drugs can be also excreted via milk, and this is a prime example. When you have codeine and stuff, it can go into kids and it can cause serious damaging effects. So clopidogrel, I mentioned earlier, is an example of coronary artery disease drug. It's an antiplatelet drug. It's usually given as a prodrug. So what prodrug means is it's something which is not in its active state. So it's given as an inactive state, and it's only once that it becomes metabolized within the liver that it becomes active. So clopidogrel becomes active into the thiol metabolite once it has undergone oxidation. As an example, so clopidogrel's nomenclatures here. So it's usually in an inactive form, so oxidation by cytochrome, and then it's inactive, and then it becomes further oxidized to thiol metabolite, which is the active form. So this is a stent. A stent is like basically a little small cage that doctors usually put in, and what this does is usually when an artery is occluded, so when it's thin and narrowed, they put a stent inside. First they use a balloon dilator to open the artery, and then they remove the excess plaque. Sometimes this plaque is within the endothelial wall, so it cannot be scraped off, and surgically removing that would mean excess bleeding and damage to the tissue. So what they do is they try to slowly expand or increase the diameter here, right? So blood can actually flow. So if I was to make that clear, so here you can see thrombus is like a lot of blood clot which is being clotted together to form a blockage. So you can see that blood cannot, on the side you can see that there's a narrow lumen now for blood to pass, and it's very hot, which means the heart has to pump much harder in order to get the required blood to the respiring tissues. Right, now with a stent, what they do is they usually remove the thrombus. Right, once they remove the thrombus, and they prevent they prevent the artery from collapsing back to its normal state by putting a wire mesh. That's what a stent is basically, and that stops it from collapsing. And clopidogrel is given post-surgery. Now, many drugs can act as inducers of P450 enzymes as well as being substrates. So one can activate the P450 enzyme itself and then become a substrate. So it's called autoinduction, which is always referred to as here. A drug induces expression for CYP isoforms, which is responsible for its metabolism. For example, rifampicin is an antibiotic, induces CY3A4 hepatic expression, and it's also a substrate. So it itself induces the cytochrome P450, and it itself becomes a substrate, so a process known as autoinhibition. Well, we've so far completed just one very little aspect of phase 1 reaction, so that's just the oxidation by cytochrome P450. Now there's non-P450 associated oxidation, then there's reduction, and there's hydrolysis. Right, non-P450 oxidation is basically a simple process as well, but it just doesn't make use of the non-P450 enzyme in the liver. Instead, it makes use of other enzymes. Now, alcohol oxidation, N-oxidation, S-oxidation, oxidative deamination, and aldehyde oxidation. These three you would have remembered from the P450 cycle. So alcohol oxidation can be primary, secondary, N-oxidation can be secondary amines, tertiary aliphatic amines, thiols, and so on. So we'll take a closer look. The main attention that you want to pay close to is the type of reaction it is, and the enzyme and the product and the byproduct that's formed. So alcohol dehydrogenation. So we know ethanol is usually oxidized to aldehyde and water, and this is done by it can be done by cytochrome P450 as we saw earlier, or it can be similarly done by an enzyme called alcohol dehydrogenase, and it makes use of NAD plus, and then it receives the loss of the hydrogen means that it becomes reduced to form NADH. Now, as I mentioned earlier in this video, aldehyde is what causes alcoholics to feel this sensation of having a hangover or some sort of schematic feeling dizzy and vomiting, nausea and stuff after they have a rough night of drinking session out with their friends. Now, doctors usually prescribe something known as antabuse. So before I go into that, just like to go over it again. Usually this aldehyde is broken down into acetic acid, which is a much less toxic compound which doesn't produce hangover effects. Now, that's done by an enzyme called aldehyde dehydrogenase, which makes use of water, and again it produces reduced NADH. So an antabuse, what it does is it is a competitive inhibitor, and it usually blocks this enzyme. This is found in the liver, and once it blocks it, it means that the concentration of the aldehyde increases in the plasma because it can't be broken down, it can't be changed into an acetic acid, which is less toxic. So therefore you feel more drowsy, you have a worse hangover, and this effect is supposed to make the alcoholic feel as if they want to give up drinking and they don't want to carry on because the unpleasant side effects and reactions basically put them off. So that's the whole aim of antabuse. Now, so alcohol dehydrogenase is the enzyme involved with alcohol oxidation. So, and you want to know that it forms reduced NADH as well as an aldehyde. Okay. Now, secondary alcohols are usually oxidized to ketones, and they can't be further oxidized. Primary alcohols are oxidized to aldehydes, and they can then be further oxidized to carboxylic acid. Right. Now, N-oxidation and S-oxidation usually takes place via the same enzyme, flavine monooxygenase, and it's found in the liver microsomes. So liver microsomes is also known as another fancy way of saying endoplasmic reticulum. Mediates N and S oxidation. NADPH is a necessary cofactor, so again you need NADPH and you need the enzyme flavine monooxygenase, FMO, and the reaction is again simple as what happened in the N-oxidation before as well. So again, what you do is you look for a NH and then you look for a side group coming off it. So this is the main molecule you're interested in. An example of this is meclobamide, which is an antidepressant and usually used to treat social anxiety, depression, and so on. So as you can see, you need the FMO, the oxygen, and the NADPH. So the oxygen is also needed. And what happens is it usually forms the bond there, so macrolide N-oxide. Nicotine is another example that we have in our cigarette smoke. So simply go over and find the N here. FMO, NADPH gets converted to NADP+. So remember, in alcohol dehydrogenase, what happens is NADH+, H+ is formed. NAD+, but in this case it's NADPH, which is the cofactor, so don't mix it up. Now, tertiary amines is another example. So sometimes we have choline, which can be broken down into trimethylamine, and then by gut bacteria, and then this is usually then broken down by FMO in the liver microsomes into, which is this molecule here. Trimethylamine is known to have some sort of smell, which is a fish odor. So if people smell as if they have some fish odor coming from them, it's usually due to an FMO deficiency, and it's known as fish odor syndrome. Okay, so that's So monooxidase MAO. So again, we go back. So what you need to know is secondary, tertiary as well. Thiols. S-oxidation is also a similar process as this flavine monooxygenase that's being converted. And we'll do a few past paper questions and regarding this, so we get a hang of like how to go about answering these questions and how we would go about solving them. So monoxide MAOs are another example, and these ones, let's go back, are using oxidative deamination, so they can deaminate primary, secondary, or tertiary. So this is the main one. Now, if you think back, deamination involved producing a ketone as well as ammonia. Right now, this is found in the liver. So MAOA is found mainly in the liver, pulmonary vascular endothelial, so in the blood vessels, gastrointestinal tract, and the placenta. So found in blood platelets, and yeah, so there's two subtypes of monoamine oxidase, MAO and MAOB. They're both found in neurons and astroglia. So inhibitors of MAOs are usually antidepressants. Rare example of drugs which are metabolized by MAO. So sumatriptan is usually given to treat migraine. Okay, so in this case, what you're looking for is simply what you want to look for is the NH. So tertiary, primary, or secondary amine. So in this case, we have primary amine. Well, we have a secondary amine here, but we have a tertiary amine here. Right, so if we look over here, what we have is indoacetic acid derivative. So deamination has occurred, so there's the N has been lost and that has been converted into a carboxylic acid. Aldehyde oxidation is the next one, which we didn't see in P450 enzymes. Aldehyde oxidase is located in the cytosolic compartment of tissue, so it's in the cytosol, and it converts aldehydes into carboxylic acid, catalyzes hydroxylation of some heterocycles, oxidase intermediate products. So, for example, once P450 catalyzes alcohol into aldehyde, or from the dealkylation, whatever aldehyde is formed, then aldehyde oxidation is carried out via aldehyde oxidase in the cytosolic compartment of tissues and in many organs, right, which then can convert that into carboxylic acid. And monoamine oxidase can also have similar products as well. Example is famiciclovir. It's usually treated in herpes virus, but the initial prodrug that we insert is usually inactive, as you can see. First, it undergoes hydrolysis to form. So hydrolysis is breaking up using a water molecule, and then it becomes 6-deoxypenicillin, and then aldehyde oxidation takes place. So it usually, what it does is it converts it into the active form of the drug. Okay. Yeah, just make it a bit more clear. Sorry, guys. Yeah, so hydrolysis takes place first, and then another subsequent hydrolysis, and then what happens is aldehyde oxidation takes place. Something called xanthine oxidation also takes place. Hyperxanthine forms uric acid as the end product, which is reversible, and hydrogen peroxide. So azathioprine is usually given to people who just have an organ transplant. 6-MP is the active form. So now you have, so we've done with oxidation. Now you have reductions also, which is opposite of oxidation, i.e. the removal of oxygen or an addition of hydrogen. So oxidation will be vice versa of this, so addition of oxygen and removal of hydrogen. So as with oxidation, it creates a polar functional groups which are more readily eliminated. Much less common than oxidation reactions, but still important, and can be catalyzed by cytochrome P450s. Right? So the main key aspect that I want you to focus on is it's much less common than oxidation reaction, but still important. So it's not as doesn't occur as much as oxidation by P450 and non-P450 enzymes, but there is a few significant amount of reductive reactions that do take place, and it can be catalyzed by cytochrome P450s. Other reductases are implicated. Cytochrome P450 reductase is an example. So the enzyme that's involved within this process is called cytochrome P450 reductase. That's a key thing, POR. So important functional groups is the azo group, Nitro, Sulfoxide, quinones, which are found in antimalarial drugs, epoxides, heterocyclic ring compounds, and halogenated hydrocompounds. So what you're looking for is azo, so double bond nitrogen, nitro. So if you have any of these, quinolones are basically like two O's coming off a benzene. Epoxides, cyclic compounds like this, and halogenated compounds like these as well. So now, an azo reduction protonsil is usually inactive first when you start with it. So an example is, so again, what you do is first you look for that functional group here, and now what you can do is it's a reduction, so it's reduced by cytochrome P450 reductase, and it can form two ways. You can either have NH2, so it's an addition of hydrogen, remember, this is reduction, so you can have NH2 here, which is the inactive form, or we can have sulfonilamide, which is the active bacteriostatic. So bacteriostatic drug is basically simply something that stops replication of bacterial Streptococcus aureus, Staphylococci, Cryptococcus fungi, and various different bacteria, but it doesn't kill the bacteria, so it's not bactericidal drug. Protonsil is basically a prodrug, which is then, once metabolized by reduction, it gets converted into sulfonilamide, which is the bacteriostatic drug, which is the active form. Nitro is simple, nitrobenzene, it gets converted to NH2. Sulfoxide, solindac, is an anti-inflammatory NSAID, usually in acute chronic inflammatory conditions. So you see the enzyme used here is, it can either be cytochrome P450 reductase, or it can be methionine sulfoxide reductase. So if we were to go back, it doesn't mention what enzyme is used in azo reduction, so I'm guessing it will be cytochrome P450 reductase, because it says that other reductases are implicated, can be catalyzed by cytochrome P450s. Other reductases are implicated, but cytochrome P450 reductase is the main one, right? So going back, so this is solindac, so methionine sulfoxide reductase is the enzyme used here, and it goes into solindac sulfide. So for sulfoxide, what you do is you look for this group here, and you simply get rid of the oxygen, and you form, what you just do is get rid of the oxygen, and that's the active form. This is the active form, but it was also made to make it more hydrophilic and less lipophilic. This is a way of doing it. Now, quinone and epoxide reduction. So vitamin K, as you may all know, where you can get it from fruits and stuff, and it's a very important substance involved within production of clotting factors, and it's something that you need very highly in order for blood clotting. Epoxide usually starts off as vitamin K epoxide is usually converted into vitamin K, which is the active form. In animals, we can get this from fruits and things like that, but in animals they start with this. So epoxide reductase gets rid of that to form the active form of vitamin K, and then vitamin K hydrolase converts into vitamin K hydroquinone, which is the active form for producing clotting factors. So warfarin is a drug anticoagulant, so it decreases the production of clotting factors, and what it does is it usually inhibits these two enzymes here. So it inhibits epoxide reductase, and it can inhibit that, so it storms vitamin K forming, and then which means that it can't form the vitamin K hydroquinone, or it can act and bind onto vitamin K hydrolysis, which is getting rid of the double bond O's, right, to produce the vitamin K hydroquinone. If you go back, quinones look like this, and epoxides are this. So you clearly see that this is the epoxide, and this here is a quinone. So you want to be aware of these two drugs: epoxide reductase and vitamin K hydrolase. Now, halogenated hydrocarbons reduction is also something similar. So all you do is get rid of the one of the chlorines in this case and add a H. So chloroform is usually given as a sedative. So if you ever were in sedation, so just before a surgery or something, they might administer chloroform, which makes you sleep. Now, hydrolysis usually means the cleavage of chemical bonds by the so far we've done reduction, oxidation, non-P450 associated oxidation, xanthine oxidation, so the acetylpyrene, which is usually given for people undergoing as an immunosuppressant given to people undergoing organ transplant, and that has different ways of forming the needed. The 6-MP is the primary metabolite, which is formed from transferases, but xanthine oxidation can also form 6-diuric acid. So going back, so hydrolysis was the next process that we were meant to talk about. So it usually means the cleavage of chemical bonds by the addition of water. Hydrolytic reactions do not involve, so the main thing you want to take away is usually involves the addition of water, and they don't involve hepatic microsomal enzymes. A reaction occurs always in the plasma and many other tissues. So hydrolysis looks for esters and amides, so these are the two functional groups that you're after when you're looking for a hydrolysis reaction. An amide would look like this, and an ester would look like this. And two key enzymes is carboxylesterase 1 and carboxylesterase 2. Now, plasma esterases, there are other esterases, enzymes also involved. Plasma esterases, liver, brain, but an example would be, so first you would look for this molecule here, so it's heroin. You look for the functional group wherever you can find, so it's clearly not an amide because there's no NH2 groups around. I can see an ester. It's not an ether, it's an ester because it has a carboxylic. If you break it up, you can form a carboxylic acid. An ester is formed from a carboxylic acid and an alcohol, so you can see that's an ester there. So once this breaks up, you end up forming an H, and you can form 2 carboxylic acid, also known as, in this case, it's acetic acid, which is basically vinegar, for those of you that didn't know. Aspirin is also an analgesic, or you might have taken aspirin as an NSAID, so anti-inflammatory agent for pain relief. It's usually catalyzed by the enzyme carboxylesterase 2. So again, we look for the functional group first. Here in this case, here's the functional group, the ester molecule. So we break it there, and we end up getting salicylic acid. So when aspirin is administered, it usually gets converted into salicylic acid within the body by hydrolysis reaction, and by the help of carboxylesterase 2. But the side product is not given here, but the product that you make, byproduct you would achieve from this hydrolysis reaction is carboxylic acid. Ester hydrolysis, another example. Procaine. So procaine is a local anesthetic. So what you can do is again look for an amide linkage, so it's not here, so therefore we can find an ester linkage right there. So you break the bond here near the carboxylic side and you end up getting p-aminobenzoic, so there's an example of a carboxylic acid, and you end up getting diethyl aminoethanol. So this compound here is the active form, and this is catalyzed by the enzyme esterase. So now, if you remember back, hydrolysis doesn't involve any hepatic enzymes, microsomal enzymes, reactions, but it doesn't mean that, but it does have its own enzymes. Okay, so don't forget that. Now, reactions occur in the plasma and many other tissues, so keep that in mind. And the two key enzymes that you want to look out for is carboxylesterase 1, CB1, and CB2. So carboxylesterase 1, let's learn a bit more, is a serine esterase found in many tissues, plasma, but very high levels in hepatic tissue. Key enzyme responsible for metabolism of a wide range of drugs. In some cases, C1 is responsible for both inactivation of prodrugs, example clopidogrel. Now, we saw earlier that clopidogrel is usually formed into the active form here, right? So it's usually given as it's an antiplatelet drug, usually given initially as a prodrug, which then undergoes oxidation in order to become active, but in the presence of carboxylesterase 1, it can be hydrolyzed and to form the inactive version. The impaired CS function causes increased formation of active metabolite, increased efficacy of clopidogrel. So it's important that, sometimes you need a balance between this and this. It's not always good to completely get rid of carboxylesterase 1, which means that you end up producing very high amounts of active form of clopidogrel, which then leads to can form various side effects. But you need some also keep it to a minimal content. So this is done by the enzyme CES1. Example is irinotecan, colorectal cancer. It's a prodrug. Is the SM38 form is active metabolite, and carboxylesterase 1 usually makes it into the active. The irinotecan is given as a prodrug, and it becomes active once it undergoes carboxylesterase hydrolysis by carboxylesterase 1. Now, amides usually use amide hydrolysis. Again, we're looking for a molecule like this. This is the functional group, but we mainly use carboxylesterase 2, and is found in the smooth endoplasmic reticulum. Amide of the cell. Amide drugs are more resistant to hydrolysis, or they're not hydrolyzed until they reach the liver, than ester drugs, which are susceptible to plasma esterases. So CES2 is only found in the smooth endoplasmic reticulum of the liver. So hydrolysis of amide usually take place within the liver. So which means they're more resistant to hydrolysis compared to esters, because they're more easily hydrolyzed due to the fact that they're more susceptible to plasma esterases and they don't have to usually wait until they get into the liver. Now, always when you do the esterase equation, always don't forget to put the H2O. Byproduct of this is always ammonia, because you get NH3, and you also end up getting a carboxylic acid. So examples given here. So first what you do is you look for the functional group. So here you can see that this is the functional group. So you break it apart here and you end up getting an NH2, and then you can form this. Or you can break it here and form the carboxylic acid. Okay, if you get that, then that's fine. Now, so we're done with hydrolysis, and we're practically done with all of phase 1 reaction. So just to go over everything from the start of phase 1 very quickly. So we start off with P450 associated oxidation. So this is aliphatic hydroxylation caused within the liver, so found in the endoplasmic reticulum. So if you were to go back and search a bit more about where P450s are found, P450 is a terminal oxidase component of an electron transfer system in the smooth endoplasmic reticulum of the liver, and it's associated with having 3 different molecules as cofactors in order for this reaction to work. So the first one is molecular oxygen. You also need NADPH, which donates the electrons, and then cytochrome P450 reductase. So we know how it works. So initially what happens is the substrate binds, the first reduction takes place, in which the cytochrome P450 reductase gives up an electron, causing the NADPH to become oxidized, and this causes the Fe3 plus and the heme porphyrin to become Fe2 plus. Oxygen is then added to the compound, and the electron is given to the oxygen. A second reduction takes place, in which oxygen is given to form a superoxide. This superoxide is then removed and combines with protons to form water, and the leftover oxygen is then transferred to the drug to form a chemical bond. For example, in this case it will be epoxide. So it forms an oxidation. So you have aliphatic hydroxylation, so you look for CH3 and you simply add the O and the OH, so torbutamide is an example. Salicylic acid, so you look for a benzene and you add an OH. Next one is lignocaine, which is anesthetics. Again, same thing, you look for the benzene ring, which is shown here, and then you add. So in this case it will be 1, 2, 3 hydroxylignocaine. Carbamazepine, epoxidation, again the same thing. Dealkylation has 3 different forms, O, N, and S. Phenacetin is the older form of related to paracetamol, and once it becomes dealkylated via P450 oxidation, it becomes paracetamol and an aldehyde. So the key thing is it always forms an aldehyde. N-oxidation is secondary amines. So deamination was primary, or you could say any type of amine. Deamination can be primary, tertiary, or secondary. Dealkylation, however, is tertiary amines. Alcohol oxidation, dehydrogenation, and dehalogenation. So deamination, I forgot to say, is the key thing is it ends up forming ketone, which is an inactive metabolite, and ammonia. So there's 18 families, so different forms include 2D6 morphine, 2C1819, which is clopidogrel, aspirin is 2C8, CPA1, CPA12 is caffeine, different isoforms, but some drugs, bear this in mind, that some drugs can be metabolized by the same CYP isoform. Drug-drug interactions. Two drugs can usually compete for the same enzyme, so it basically means one drug will be more avid and it can suppress the effect of the other one. Drug-diet interaction. Active compounds of certain foods can be P450 substrates, example warfarin. Patient genetic variation in gene encoding. Underlying disease, environmental lifestyle, smoking and alcohol. Codeine primarily metabolized to morphine by cytochrome P450 2D6. So some people, pharmacogenetic, it's come on to that a bit later. So we have non-P450 oxidation, which involves alcohol oxidation, which is done by alcohol dehydrogenase, can be primary, secondary. This enzyme is also requires NAD plus, which gets converted to NADH. N oxidation takes place, and S oxidation also takes place. Flavin monooxygenase is the enzyme required. It's usually found in the liver microsomes. So moclobemide is an antidepressant, as you can see here. Flavin monooxygenase can also be used for the fish shoulder syndrome. Now, N oxidations, oxidative deamination makes use of MAOs. MAOs can come in two forms: MAO-A, found in liver, endothelial cells of the blood vessels, gastrointestinal tract. MAO-B, however, is only found in blood platelets. Sumatriptan used in migraine. So you can see that monooxidase usually converts it. Aldehyde oxidation is another form. It forms it into carboxylic acid is the byproduct that you get from clover to see herpes virus. Only becomes active when it's in the pentaclover form, which is the after the aldehyde oxidation takes place. Reductive reactions are opposite of oxidation, and you look for functional groups like azo, the N double bond N, Nitro, Sulfoxide, Quinone, Epoxide, and tetracyclic rings. So here you have the functional group is azo, so you can have protonzol, which is then converted by reduction, so the addition of hydrogen, is usually done by cytochrome P450 reductase, or rather reductase enzymes. Nitro reduction, sulfoxide reduction, sulindac and aniside. Methion sulfoxide reductase. Vitamin K is usually in the form of a epoxide at the start, and epoxide reductase converts it into vitamin K, which can then be done by vitamin K hydrolase to vitamin K quinone. So here's the quinone functional group, and here's the epoxide, which can then go on to produce clotting factors. Hydrolysis, mainly look for esters and amides. Example is you can have plasma esterases, liver esterases, brain esterases. So esters are more common. It can be done via any type of extract. Heroin is usually broken down to morphine via carboxylase esterase 2. Aspirin is usually broken down by esterase 2 as well, CES2 into salicylic acid, and the byproduct is always usually an carboxylic acid. Procaine is probably broken down by CES2 as well. Now, carboxylesterase 1 is mainly found in the hepatic tissue, whereas hydrolysis reactions usually take place in the cytosol. Reductive reactions. Yeah, so we go back. Hydrolysis. So in this case, clopidogrel can be formed to be inactive in this state by CES1, which is key responsible metabolism enzyme. Irinotecan, which is used to treat colorectal cancer, prodrug hydrolyzed into SN38. So SN38 is the active form, and this is done by the hydrolysis of carboxylesterase. So it breaks down the you can see the ester bond here. Amide is usually done by CES2. So things you need to keep in: irinotecan, which is NSAID used in colorectal cancer, clopidogrel, right? Amides are, you look for something like this. And always forget, hydrolysis, one thing you forget is you always forget to write H2O, even though you put the enzyme down. And it forms ammonia and carboxylic acid. And so next time we'll look at phase 2 metabolism. So that's all of phase 1. So, I mean, that's a very loads to memorize. But this is what basically happens. So you got oxidation by cytochrome P450, non-P450 oxidation, reduction, and hydrolysis. And next time we'll be looking more in detail about phase 2 conjugation reactions and what happens in phase 2. So yeah, so thank you for listening. Please subscribe to my channel, leave a like, leave a comment on what I could do better and what I could improve on. And once again, all credit goes to Dr. Stankar from the University of Liverpool for creating these lecture slides. And yeah, thank you.